Time for great smiles, making sure that you have a smile worth looking at. How about that?
Yeah.
So we have a chance to see Jackie's progress. She's not in very much pain, which is nice.
That's good.
And you're straightening out her teeth, and they're moving rather quick.
I know.
Yeah, I've already seen progress. It's not even been 2 weeks.
Couple weeks, yeah.
Couple weeks, and I'm like, whoa, okay, yeah.
Now, can you feel it with your tongue?
Oh yeah, is that weird?
Yeah.
You're like, everything you're supposed to not to do.
No,
which
everybody
is like,
does that, yeah.
I'm feeling it.
Yeah.
I'm like a teenager again. I'm like, oh yeah, that's so weird. But
Still get your braces locked, with
other boys.
Right,
yeah.
right. Yeah.
I gotta stay away from the boys.
Yeah.
But
Does that actually happen?
I don't know.
Oh.
I hope not.
That's funny to
really,
think.
really
no,
hope not.
sparks happen.
Yeah. So do you have to go in with the ratchet wrench and move them a little bit every week? Or?
A little bit, yeah.
Every couple of weeks have to go in, but
Okay.
they're moving pretty quick, and I know we call it 6 month smile, but it probably won't even.
It probably, not for you, it probably won't take that long. So,
No, for
'cause
you,
you're
Jason.
extra special.
Oh, thank you.
They tighten them up a whole bunch more. Is it that quick? But we're talking about going back to school.
I
right?
know,
And what we need to keep in mind for kids going back to school.
Yeah, well, I mean, the big thing is clearly just make sure that now that we're getting kids on a routine, make sure we're getting them back in their health care, oral care routine. And before I had kids, I think it was really hard for me to fathom how you couldn't get your kids' teeth brushed or why they didn't floss and that kind of thing. And wow, I had a lot of humble pie on that, that whole thing. I mean, we have days where we look at our kids and we think, I don't think you brushed your teeth today. And they look at us and they're, no, I didn't. So.
All right, so obviously it's somewhat easier to get them to brush their teeth first thing in the morning.
I think it's a little easier, but I mean, trying to get kids out of the house and that kind of thing. I mean, the most important thing is that you do your best to get them brushed in the morning and before they go to bed. If you're gonna pick one or the other, which I don't recommend that you do, the nighttime, before they go to bed at night, make sure you get all the sugar off the teeth, all the stuff off the teeth at night, because then it's gonna sit there overnight. So.
Look, I have 2 5-year-olds and a 2-year-old.
Yes.
Those are just practice teeth. I don't need to worry about those, right?
Yeah,
those are disposable teeth.
Well, it's really so. Our society is, culturally, we have a lot more sugar.
Yeah.
We have, busy schedules. So, which I have 4 kids. I totally understand, and it's hard. It's harder than I ever dreamed it would be to just get the darn toothbrush in there twice a day, and feed them something really healthy. Feed them, the crunchy foods, the celery and the carrots and the apples and things that actually disrupt that plaque that forms on the teeth and that kind of thing. Those are great foods. But skip the soft drinks, skip even juice. Juice has tons of sugar in it. Yeah. I mean it's people think of it as natural sugar, but it's still sugar.
Right.
So I mean, diet is probably the most important thing, truly, because if you don't put a lot of sugar in, your chance of getting cavities is so low. And if you disrupt it by brushing the sugar off of the teeth, you'll have so much less trouble. So
I remember as a kid, one of the things my dentist told me was I used to eat a lot of oranges all the time.
Oh yeah.
And he said that the acid was pretty tough on your teeth.
It can be, yeah. If you combine the acid, so to form a cavity, you need 3 things. You need a tooth, sugar, and bacteria. Well, the bacteria forms acid with the sugar and causes the eroding of the tooth or the cavity. So that's how you get it. So if you don't have, so tooth, bacteria, sugar, the bacteria is always in there, unfortunately, or fortunately. It's good bacteria unless you have combined sugar with it. Our bodies always have bacteria. And so if you always have the tooth, you'll always have the bacteria. Sugar is the variable. So if you take away most of the sugar, you should have very little trouble. Yeah.
Now, let's say you get the toothbrush in the mouth. They make it part of this routine. And how long? Like, I'm fortunate enough, I have a Sonicare that tells me when it stops working. Okay,
2 minutes is a really good goal. If you can get a toothbrush in a kid for 2 minutes, if in a kid, a minute is a long time.
Yeah, it's an eternity.
And they have 20 teeth. We have 32, 28. Usually without wisdom teeth.
Jackie has like 50.
Right, I know. Yeah.
Hers just rotate.
Like a shark.
Shark, yeah. Shark Week is over now. But no, it's with kids. I always tell parents to brush them as long as you can feasibly do it. Let them brush and then brush after them or before them, whichever way you want to do it. But I mean, I literally brushed my oldest kids' teeth until they were like 12. And sorry, kids, to be telling them.
You brush their teeth?
Yes, I mean they would brush
you're a
them.
dentist, so
well,
that makes sense,
they would brush them, but realistically, their dexterity until they're about 9, 10, 11 is not very good.
All right, now when it comes to brushes, Jackie mentioned she has one of these Sonic.
Oh, Sonicares are fabulous.
I have another kind of Cyber Sonic where they mail you brushes every 3 months.
Oh, that's cool.
Which is very cool. I was pretty excited. I got some new ones ones yesterday, which is really nice.
Oh, I know. Don't you get excited when the new brushes come out?
Sounds bizarre, but it's true. But is that about the time, about 2 or 3 months?
Yeah, you want to do a change out about every 3 months or so.
Even with a handheld?
Yeah, and they also make units now too. I'm sure your Sonicare has the unit where you put the head in and it kind of sterilizes the head, which is fabulous. I mean, then the bristles don't get bacteria laden, and grody is a really good word for it. Yeah,
grody.
Yeah.
Do you recommend, like I know you said you physically helped brush your kids' teeth. Do you recommend brushing your teeth with your kids so that they can learn some good techniques, or watch them and help them?
Well, help them, kind of direct them how to to get all of the teeth, because little kids like your 2-year-old, no way going to get all the teeth brushed.
You're just trying to get a habit established.
Exactly. You get the habit established so that they do it twice a day, and even your 5-year-olds, let them brush and then go back in and kind of hit the,
Yeah, we always finish it up at the end.
And since we're talking about toothbrushes, I'm glad you're here, because this is a question I wanted to ask a dentist, and I always forget. Okay, we're talking about toothbrushes, and anybody that does anything mechanical will know if you're trying to clean a part, and you have a steel brush and you have a hard steel brush, it cleans better than a soft steel brush.
Yes.
The strength of the bristles on the brush, soft, medium, or is there even a hard?
So if you only had teeth, use the hard, but you've got gum tissue around it.
Okay.
So the gum tissue is very fragile, and it's going to retreat. If you brush really hard, the gum tissue, you'll actually abrade away the gum tissue, and you'll have recession of that gum tissue, and then it compromises the tooth. So you want to be very gentle and use a soft. We even recommend like an extra soft brush.
Are you serious?
Yeah, I know, but people think that they're going to do a better job if they white knuckle it and really get in there and scrub with a really hard toothbrush. If you notice in the store, you can hardly find anything but a soft toothbrush. Even the mediums and the hard. I don't even think they make hard toothbrushes.
I haven't seen them in years.
Yeah. So, and that's why.
Okay.
Yeah.
See, answer my question. Thank you.
Good. Well, I'm glad you asked, because you shouldn't be scrubbing like you're scrubbing a machine part.
Okay.
Good to know.
I mean, until we turn bionic completely. Then,
Okay.
Yes.
Then we'll
Luke comes in, he's just bleeding. Hi, everybody.
But my teeth will be clean.
Yeah. You'll have no gum tissue left, but your
My
teeth will be awesome. Yeah.
There you go. Now,
Welcome to Great Day.
people want to get some advice of the proper way to care for your teeth. How can they get a hold of you?
Well, I mean, obviously we recommend you go somewhere, but clearly if you have no other place, dmsmiles.com is our website, and 515-612-7148.
I tell you what, you're going to have a blast. They treat you so nice. Everyone is smiling. It's the first time you go to a dentist, you're not hearing like the, you go there, everyone's happy, smiling. You get a little spa treatment going on. I actually enjoy going to the dentist.
When's the last time you could say that?
Right.
So, how about that? Well, good to see you again. Great job. As always, it is 9:22. Stick around. We'll be right back. You're watching Great Day Live.